Hello friends, today's chapter is not only important for your academics but it is also important for your career perspective. Today's chapter is the pharmacology. See friends, the pharmacology is the branch of science which is concerned with the study of medicine. In another word, we can say this pharmacology is the study of drug or the medicine. This subject has two branches. That is, one is pharmacodynamics and another is pharmacokinetics. See, pharmacodynamics is the study of effect of drug on the biological system, whereas pharmacokinetics is the study of effect of biological system on the drug. In another word, we can say that this pharmacodynamics which says what drug does to the body, whereas pharmacokinetics says what body does to the drug. Friends, now one by one we will see about this pharmacodynamics as well as pharmacokinetics. Now pharmacodynamics, which says what drug does to the body. Friends, before I answer this question what drug does to the body, one thing we have to understand, that what is drug. Friends, the drug is a substance that causes change in organism physiology when it is consumed. Now friends, the question comes that why we consume drug. Friends, we consume drug to cure, to prevent, to control disease or disorder. Friends, we have to understand what is disease and what is disorder. See friends, when there is abnormalities in systemic function or body system caused by external factors such as microorganism or pathogens, we call it disease. And when there is an abnormalities in systemic function or body function caused by internal factor, we call it a disorder. It can be mental disorder, physical disorder, genetical disorder or a structural disorder. Friends, if we have to understand drug or medicine, we should know about its sources. See friends, the sources of drugs are plants. The best example is tulsi, neem, etc. We have minerals also. The examples are iron, zinc, iodine, calcium, etc. The drug is also we get from microbes. The example is antibiotic, antiviral, antiprotozoal, antifungal, and the source is animal also. And the drugs we get from animals are insulin, cod liver oil, hormone, etc. See friends, these are the raw materials through which drug or medicines is manufactured. The drug, before it is manufactured, it has to undergo many clinical trials, and then when it is approved by US FDA, that is Food and Drug Association, it is mentioned in an official book, and then it comes in the market. The official book in which it is mentioned is called Pharmacopoeia. See friends, it is an official book containing a selective list of established drugs with details of their formula, physical properties, purities and potency. Few of the known pharmacopoeias are IP, which is Indian Pharmacopoeia, BP, which is British Pharmacopoeia, and USP, which is United States Pharmacopoeia. Now this drug comes in the market, and in the market we see different forms of drug. Friends, the different forms of drugs are solid form, semi-solid form and liquid forms. The example of solid forms are the tablet, capsules, and the semi-solid forms are the ointments, whereas the liquid forms are the syrup as well as injection. Now, according to these forms, the drug is administered in the body. Friends, now we will see the route of administration of drug. See friends, when we consume drug through any route, it has to go in the blood for its action. Therefore, to reach the drug in the blood, we have two different routes. One is enteral route and another is parenteral route. See friends, enteral route is through intestine, where drug is taken and it goes in the blood, whereas parenteral route, it directly goes into the blood beyond intestine. And this enteral route is also known as oral route, and the examples are tablet, syrup and capsule. Whereas in parenteral route we have local application where drug is applied on the skin. We have sublingual routes where we take drug below the tongue and directly it goes into the bloodstream. We have a rectal route in which drug is taken through rectum and from there it goes into the bloodstream. We have inhalation route where drug is taken through nose and from nose it goes into the lungs and from lungs it goes into the blood. We have injectable route. Through injectable route also the drug goes directly into the blood. And in injection route we have different locations. These locations are, you have this subcutaneous injection we take below the skin. The example is insulin and heparin. We have intramuscular injection. In this we take injection in muscles. The example is antibiotic, anti-inflammatory. The another route of injection is intravenous injection, in which the injection is taken in vein. The example is antibiotic, emergency drug. Intrathecal, where the injection is taken through a spinal cord. During a spinal anesthesia we take intrathecal injection. We have intra-articular injection where the injection is taken in joints. In arthritis we take anti-inflammatory through this intra-articular injection. We have intra-arterial injection. It is the injection in which we take through arteries. This route is very uncommon. So friends, we have seen the different routes of administration of drug in our body, and when it goes into the blood, its effects starts. The effect of drug is either desired effect or undesired effect. In desired effect, drug will either diagnose, cure, treat, control disease or disorder, and in undesired effect, the drug will give either side effect, adverse effect or toxic effect. In side effect, it is the less effect which is under control. In adverse effect, which is not under control. And in toxic effect, it can be even death. So friends, we have seen the different effects of the drug on the body. Friends, either the drug give desired effect or undesired effect, this drug has to enter in the body cell. The different ways through which the drug enter into the body cells are through enzymes, through ion channels, through transporters or through receptors. The most common route is through receptors. See friends, in this picture you can see the receptors are present on the cell membrane. The drug attached to these receptors and enter into the cell. Friends, the efficacy of drug depends upon the number of drug receptors present on the cell membrane, and the more receptor is there, the more efficacy of the drug. You can see in this picture, the drug reaches more receptor have more efficacy, and the drug having less receptors have less efficacy. So friends, we have seen the efficacy of drug. How can we distinguish between the two drugs? Now friends, we will understand the potency of the drug. See friends, if two drugs have same number of receptors on the cell membrane, they are having the same efficacy. But the drug in the less quantity have the same receptor, they are more potent. You can see in this picture, drug A is 5 mg and drug B is 15 mg, and both the drugs have same efficacy, but drug A is less in quantity, therefore it is more potent. So friends, by this we can see or distinguish the potency of the drug. Now friends, we will see the we have seen the efficacy and potency of the drug. We will see how we get to know about the safety of drug. Friends, it is the therapeutic index through which we can know about the safety of any drug. This therapeutic index of a drug is the ratio of lethal dose to the effective dose, which is used in assessing the safety of drug. This can be calculated by dividing toxic dose or lethal dose with effective dose. Friends, you already know the effective dose which gives the desired effect, whereas the toxic dose is the undesired effect where we have death also. Now friends, we have seen all the effects of drug on the body, and now we will see the effect of body on the drug. And the effect of body on the drug is pharmacokinetics. Friends, pharmacokinetics says what body does the drug. Friends, you can see in this picture, pharmacokinetics have 4 effects on the body. Body does 4 types of effect on the drug. They are absorption, distribution, metabolism and elimination. Body absorb the drug, body distribute the drug, body metabolize the drug and body eliminates the drug. Friends, now one by one we will see all the activities of the body which is there on the drug. The first is absorption. Friends, there are 4 mechanisms by which the body absorbs this drug. These mechanisms are passive diffusion, facilitated diffusion, active transport and endocytosis. In passive diffusion, the drug comes from higher concentration to the lower concentration and get inside the cell. In facilitated diffusion, the drugs come from lower concentration to higher concentration and it gets inside the cell. Whereas in active transport, drug comes through channel, and in endocytosis, cell engulf the drug and take it inside. So these are the 4 mechanisms through which drug is absorbed in the cell, and after absorption, drug goes into the bloodstream. In blood, it binds with plasma protein and reaches its maximum concentration in particular time. And this maximum concentration of drug is called Cmax. See friends, this is the peak plasma concentration of drug in the blood at a particular dose. And I will give you one example. If we consume 100 mg drug orally, and after absorption 40 mg reaches in the bloodstream and rest 60 mg is eliminated out, this 40 mg is the Cmax of this drug. Friends, we have seen that to achieve this maximum concentration in the blood, drug takes time, and this time is Tmax. Friends, the time taken to achieve peak plasma concentration of drug in the blood at a particular dose is the Tmax. Again friends, I will give you the same example. If we take the same drug, that is 100 mg, and 40 mg is the maximum concentration which drug achieve in 2 hours, this 2 hour is the Tmax of this drug. Now friends, when this drug achieve its maximum concentration in 2 hours, then drug is being distributed. The distribution of drug starts. Friends, after a drug is absorbed in the bloodstream, it rapidly circulates throughout the body. And the factor on which the distribution of drug depends are the blood flow, lipophilicity of drug, capillary permeability and plasma protein binding. Now after distribution, metabolism starts. Friends, this metabolism is a chemical alteration of drug by the body, and this metabolism starts in liver. Friends, liver metabolize the drug via a special group of enzyme called cytochrome P450. Friends, liver changes the chemical structure of the drug and make it water soluble, and thus increase the ease with which it can be excreted out from the body through urine. So this is how the metabolism takes place in the liver. Now friends, when we take any oral drug, blood has to undergo the first pass metabolism. Orally administered drug passes liver first before entering into the circulation, where portion of drug gets metabolized by the liver. See friends, in this picture you see, if we take any oral drug, it goes in our intestine. From a small intestine it is absorbed and it goes in the liver through first pass metabolism, and after this the liver, it goes into the systemic circulation and then to blood tissues. So this is the first pass metabolism, where the portion of drug gets metabolized by the liver, and this portion of drug which is metabolized by the liver is the bioavailability of the drug. Friends, the bioavailability is the fraction of drug reaching systemic circulation after undergoing first pass metabolism. So friends, we have seen this bioavailability. Now we will see the last action which body does on the drug is elimination. Friends, elimination or excretion is done through different channels, and the channels of drug excretions are kidneys, lungs, bile, milk and saliva. So through these channels drug is eliminated from the body, and there are two orders or methods through which drug is eliminated from our body, and these orders are the first order elimination and zero order elimination. In first order elimination, the constant fraction of drug is eliminated per unit time. Friends, in first order elimination, the rate of elimination is directly proportional to the plasma concentration of the drug. Higher is the concentration of the drug elimination is more. So this is seen in first order elimination, whereas in second order elimination the rate of elimination is constant per unit time and the amount of drug eliminated per unit time is same, irrespective of the plasma concentration. So this is the zero order elimination. You can better understand with this picture. In first order elimination, see friends, the rate of elimination is directly proportional to the concentration of the drug in the blood. Say for example, if we take 1000 milligram of a drug, in every hour the percentage of elimination is same and the quantity of drug variable, and the graph which is seen in first order elimination is like this, whereas in zero order elimination you see rate of elimination is constant, that is percentage varies but the quantity is constant, 1000 to 800, 800 to 600 and then 400. So 200 milligram is eliminated at every intervals. So this is the zero order elimination, and in this you will get the graph which is straight. Friends, you have seen the elimination part. Friends, now if drug is eliminated from the body, its concentration will decrease gradually and a time will come when its concentration will become half of its peak concentration, and this time is called plasma half-life or T-half. Friends, you can see in this picture here there is a injectable which has been taken 40 milligram, and when there is any injectable dose, in zero time it reaches in peak concentration, and here the peak concentration is 40 milligram. Now after this, through the process of elimination, the concentration of this drug will gradually decrease. Here it comes 20 milligram, that is half of the concentration in 8 hours. So friends, this plasma half-life or T half is the time taken by the drug in the plasma to reduce 50% from its peak concentration at a particular dose is plasma half-life. And in this graph, the 20 milligram is the half concentration from the peak, that is 40 milligram, and it comes at 8 hours. So 8 hour is the plasma half-life of this drug. So friends, we have seen the plasma half-life. It is the concentration which comes half from the peak concentration, and the time is called plasma half-life. Now friends, we have to understand how the dose of any drug is calculated. Friends, the dose of any drug is calculated through area under curve. This area under curve is the plasma concentration of drug versus time. As you can see in this graph, plasma concentration of drug versus time is AUC, that is area under curve, and this area under curve determines dose and also identify the potential of drug. So friends, here we end our pharmacology. Now before I close this video, we will see the question which is important for your interview. And these questions are: what is pharmacology? What body does to the drug? What is Cmax? What is Tmax? What are the undesired effect of the drug? What is drug? Why we take drug? What are the channels of excretion? What is pharmacopoeia? What is plasma half-life of drug? And what is a steady state concentration of the drug? See friends, a steady state concentration, which we have not discussed earlier in the video, this is the concentration of drug in the blood plasma when rate of administration is equal to the rate of elimination. Once again I repeat, the steady state concentration is the concentration of the drug in the blood plasma when rate of administration is equal to the rate of elimination of the drug, and it is usually seen after approximately 4 half-life of the drug. So this is all about the steady state concentration. So friends, I think by listening and seeing this video, you can answer all the questions. So friends, thank you very much for your patient listening. Thank you friends.